Assalamu alaikum. In the earlier video, we discussed about the long QT syndrome and some of its causes that are included in these two categories. Now we are discussing its third category, that is others. In others category, we have electrolytes. These are three important minerals that are important, and their deficiency can cause long QT interval, and it can precipitate the episodes in susceptible patients of the long QT syndrome. These are the hypocalcemia, hypomagnesemia, and hypokalemia. And other conditions that can cause that can precipitate the long QT syndrome are acute MI, myocarditis, hypertrophic obstructive cardiomyopathy. So remember, three were electrolytes: calcium, magnesium, potassium. And three are the cardiac conditions that are cardiac pathologies that can cause long QT interval. And then we have some other conditions. These are three other conditions. These are the hypothermia, subarachnoid hemorrhage, and hypothyroidism. So to sum up the conditions, we went through the congenital causes that were Jervell-Lange-Nielsen syndrome and Romanov-Ward syndrome. In the drugs category, we have a list of the drugs that we have to remember. And then in others category, we have three categories we can remember. One is electrolytes, in which we discuss these three electrolytes. And then we have some cardiac pathologies that can cause long QT syndrome. And then we have this other category that includes hypothyroidism, hypothermia, hypothyroidism, and subarachnoid hemorrhage. Now there's little bit detail about the Jervell-Lange-Nielsen syndrome. It is actually caused by mutations in the CACNE1 and CACNQ1 genes. Now these genes are important for the proteins. Those proteins are important to form the channels that transport potassium out of the cells. And this movement of the potassium is important in case of these genes for the inner ear structures and for the cardiac muscles. If these genes are defective, that is mutated, that will lead to the mutated protein, and that will be not able to transport the potassium as it was doing normally, and that will disturb the functions of the inner ear structures and cardiac muscles. Hence, in case of the Jervell-Lange-Nielsen syndrome, the patient can present with long QT syndrome as well as deafness, and that is the sensory neural deafness. The cardiac conditions in the causes category will cause long QT interval, not the long QT syndrome that I said mistakenly. Thanks.